Basically, what we need to do is embrace the power of teamwork, different strengths with different organizations. Ministry of Health can do one thing. Ministry of Water can do another. The partners is their other strengths. So we bring all our strengths together and also our weaknesses so that we are able to leverage on each other's strengths. And for that note, the WASH hubs, they need to be active. Because when we are meeting here, what data will we be having? We need to have that data, get to know where we are so that we can know exactly what we are reviewing. And then we also need to move to adoption of local solutions for local problems, both in rural and urban setups. Because Kenya is a growing country. We cannot go importing solutions from other countries which probably do not experience the problems that we have. And I believe this is what this work plan has spoken to.
USAID's health office works with the Ministry of Health, the National Ministry of Health, and in select counties through integrated projects that have the objective of increasing access and demand for quality family planning, reproductive health, maternal, newborn, child and adolescent health, nutrition, and WASH. The USAID community-supported interventions focus on increasing the number of people who are able to access clean, safe drinking water, basic sanitation services, and reducing open defecation with the aim of earning Kenya the ODF status.
As a ministry, we would want to focus on the SDG 6.2, which basically states that we want to achieve access to adequate and equitable sanitation and hygiene for all and end open defecation. This is something that all of us aspire to, and the goals that we need to really look at. In collaboration with our stakeholders and partners, we have the rural sanitation and hygiene protocols that have been put in place. And these are documents that we have reviewed from the ones which were there previously. And therefore, we need to look at the rural aspect on sanitation and hygiene. And these protocols really speak to us and give us what we need to do then to achieve the health for all and also achieve the 6.2 target.
Then on the safely managed sanitation in urban and informal settlements. This is the second pillar, as I explained. I think Fresh Life also explained how much waste has been collected and safely managed during 2022, maybe 170,000 tons if I'm not wrong. And it's a very effective project. I propose all of you to have some time and visit that project, because if that project is scaled up, we will be able to handle the universal health issues of millions of population that lives in urban slums of Kenya.
In terms of financing mobilizations, we aim at least 10 million Kenyan shillings will be allocated and utilized toward the elimination of open defecation at county level. For this, we keep advocating for factoring sanitation hygiene activities and budget in CIDP.
That we need to ensure that partners have their progress updated in the system. This is usually a challenge as we all support different counties when it comes to activities on open defecation, but then when we look at it at the national level and even global level, we are not able to report on this. County teams also need to ensure that there is prompt update of the progress, and that is why this system is commonly known as a real-time monitoring information system. We also need to ensure that our officers are capacity built frequently, including fresh trainings, refresher trainings, and also on-job trainings.
I'd like to recognize our strong partnership with the government of Kenya, both at the national government level, with the ministries, as well as the Council of Governors. Without that strong partnership, it would be hard to move forward with strategic frames and strategic approaches that we are supporting as one of the partners in Kenya The focus should be on long-term resilience and water security for domestic and productive uses in the areas most affected. Building the resilience of the families most likely to be impacted must be a priority for everyone.